clear?
Yeah, okay, thank you, sir. And one question arises at the first class itself. Why females are more prone to this thyroid? Is there any answer on you?
Actually, it's actually a very challenging question. So for Ayurveda, many diseases will have a statistical domination. In availability. There are different reasons. From an Ayurvedic perspective, woman body is more kleda pradhan. Kleda, the kleda. So the kleda is generally increase in woman. Rasadhatu of the woman is also slightly differ from male. Because Rasadhatu is related with Stanya, Rasadhatu is related with Artava. And the female. So the Rasadhatu, Shukradhatu, Medodhatu, these many of the dhatus are very different, especially the Kleda dominant dhatus are slightly different from the male than the female. Maybe that is the reason why they have a possibility of changing this Kleda and the Kapha association. That make the thing.
Thank you, sir. And next question regarding where the modern medication we stop. How we can stop the modern medication along with the Ayurveda treatments?
Normally, if the patient is having already L-Troxin, so they are already taking Thyroxine. If it is a fresh case, okay, just started within a 6 months. TSH is below 50. If you are a beginner in the thyroid management, don't take big risk. Maybe TSH is 25 to 50. They are already taking 25 mcg of thyroxine. Definitely, you just tell them stop thyroxine. Start Dadimadi. Start Hamsavatyadi or Kanjana Guru like that directly, no problem. But if their person Person is already having thyroid problem from last 3 years. Already taking more than 50 mcg per day. Very symptoms are very dominant. Better don't start immediately. Ayurveda, you can start Ayurvedic medicine, but don't directly reduce 50 to 25 or something like that, or stop. Rather, you give Ayurvedic medicine for first 2 months. Check it the status. Definitely, TSH will not come down by Ayurvedic medicines. If it is normal, it will stay normal itself. Don't expect that, okay, Ayurvedic medicine, we are giving thyroid dysfunction. So TSH level is already, now it is only 4.3. So I am giving Kanjana Arabuglu, I am using Annabedi Sinduram, I am using Hamsavatyadi. So since I am using hypothyroid medicine along with the modern medicine, you should go down so that the patient should get hyperthyroidism. No, it will not happen because our medicine doesn't work like that. Modern medicine will work like that. If you use a neomarcosol in an abnormal dosage, definitely you know what happens. Or if you use thyroid instead of 50 mcg, they start taking 100 mcg, then the thing which is maybe 5.5 will go from 0.01. They will have a bounce back mechanism. But Ayurveda doesn't work like that because Ayurvedic medicine is totally different. So what we have to do, such cases, is that start slowly, start Ayurvedic medicine for 1 or 2 months, then observe the symptoms, then slowly taper down. Every 6 weeks, you can reduce the dose. So first is 50 mcg. So after 6 weeks, you reduce into 25 mcg. Then wait for another 25 mcg. Then from 25 mcg to 12.5. Then like that. That's a better way. But if you are a very specialized hypothyroidism people, you are, or if you are already treating her thyroid dysfunction from last 5 years. You are seeing at least 100 cases and all. You know the you have an idea how things are going. Just like if you're a good driver in the road, he knows when he has to pace and when he has to slow down, like that. So if you are a good clinician, experience in that area, you can do some higher work. But as a beginner, this is the thing.
Okay, thank you, sir. And so many questions regarding the Dadimadik Jada. In which condition? And
what is Talapodichil? I seen there is a chat. What is Talapodichil? It is a very traditional. Can I explain that in a quick way?
Yeah, sure.
Yeah. Okay. It is asked by Sanghamitra Ashok Nandir. It is a very Kerala traditional procedure. Talapodichil word means cover the head. So there is a tradition of usage of amalaki powder with musta or different herbs, which is mixed with the buttermilk, made a paste, a kalka, and pack the whole head and keep it for some prescribed period of time. That is the Talapodichil. It is something like a talam. These are very unique procedure used in the head for different diseases. And the next question was, what is the dosage of Dadima Dikrida and how to give it in the patient by Dr. Yudu? I think I already told that. So if Agni is really bad, you may start with half teaspoon, but generally you can start with 1 teaspoon in the morning. If they feel very discomfort, consuming Dadima Dikrida in the morning, they can even take in the night. After food. I tried such method also, found highly effective in that time too. And many times people should be happy to take Dadima Dikridam because it's not having any bad taste at all. Maybe this is one of the ghee, Ayurvedic ghee, that can have some palatability. because the ingredients are Dadimat Kuda that yogam is that Chitrakam Shingi Veramcha, that yogam. Dadimat Kudubo, Daksha Kudabadram Palam Palam Chitrakam Shingi Veramcha. So those medicines are all little bit sweet and taste. So it's nice to take.
Okay, thank you, sir. And next question regarding in the case of pregnant woman, how we can administer our medicines, especially the Adimadikruda like medicines.
Normally, after first trimester, you can try Dadimadikradam. But adolescent and in the pregnant woman, don't play with thyroxine, levothyroxine with Ayurvedic medicine. Because if I had a bad experience also in treating thyroid dysfunction. I'll tell you openly. I was treating a woman, not woman, a girl. I should say a girl. She had a thyroid dysfunction, also polycystic PCODs. And I was treating her when she was age of 18. And she was treated for 2 years and everything become normal. PCOD become normal. Thyroid become normal. And I advised her to continue prescriptions and inform me whenever you want to check it. She got married in after a year. So she herself decided that since everything is normal, let me stop all the medication, and it's it's very difficult to carry this medicine to the husband's house and what they will think. So she stopped all the medication. She got married, and the next 7 months, within 6 or 7 months, she got conceived. And during after a third month or fourth month, they checked her thyroid functions, and it was absolutely very, very alarmingly disturbing. TSH was very, very changing. And moreover, she is not under medications properly. And they started levothyroxine in small dose. It doesn't work very well. And they are recommended her to go for MTP, medical termination of pregnancy, because they found that the babies have some abnormality, which in turn may end up with cretinism, the problem with growth. So I felt very disappointed, because even though I was cautious about the condition, I was told her in a short way, but I felt very bad myself, because I could have alarmed her in a more severe, serious way. So that she could take it as a very serious thing, as she is moving towards a reproductive life. She called me and told about the whole story, so I felt she felt very bad. She was very hesitant to say these things to me, because she realizes that it is her mistake, and she was not taken the words from me. I asked her also, why didn't you ask me? You got married and going for a reproductive life. You could have, you know me from last 2 years. You know how busy our practices are. So sometimes we don't remember all your life long detail. But you are coming to my clinic for 2 years, so I know you. So you could have just remind me about your health issues. Since you are going for marriage, I could have given you a better ideas. So that's the other thing. So never take risk. During pregnancy period or reproductive period, playing with altroxin with Ayurvedic medicine. But of course, after a long experience now, I am doing in some cases, but I still tell you, don't try, because if you are not very strongly experienced, you may end up with some problem. But still again, you can use Dadimadikridam during the pregnancy period after first trimester at any time. No problem. It can support those who are taking levothyroxine.
Okay, thank you, sir. And regarding the any external treatments for goiter?
Traditionally, there are many practices found good result. If you are having not a Hashimoto thyroiditis, a simple thyroiditis, you can use Grihaduma the Lebachurnam, the Grihaduma the Lebachurnam plus Dhanyamlam mixed with that shows very good. Dhanyamlam, you may be knowing what is this Dhanya. You know that Kanjiga and Grihaduma. The folk practitioners use the root of Lajjalu. The Lajjalu, Tottavadi is a Malayalam. Name. Lajjalu is the Sanskrit name. I think it is Mimosa pudica. Do anybody say, is it a Mimosa pudica? I don't know the exact botanical name. I think that is the one. Lajjalu. Yeah. So the root of it is very, very efficient to bring good result. Another practitioner was using the powder of Vipithaki as a common prescription powder of Vipithaki application. In the neck, and they were saying that this also good, having good result. So there are different practitioners using different herbs for that, but what I want to say, it all depends upon the pathology of the thyroid gland. Okay, if you have a thyroiditis, it can bring good result. If it is Hashimoto thyroiditis, very, very difficult. If it is a nodular goiter, okay, you can reduce the size a little bit, not too much. If it is a total goiter, then definitely it is very, very difficult. That's the thing.
Okay, thank you, sir. And how Rakta Moksha is done in thyroid disorders? Is there any you already mentioned?
Actually, as I mentioned you, I haven't done many cases. I have done only very, very few cases personally. But Dr. Sita, she was a PG scholar from Trivandrum Ayurvedic College. She made a wonderful study on the thyroid, and I spoke to her also. She's shown me also some of the cases what she has done, and significant result has been done. My PhD work is on thyroid. So I was collecting all the information about thyroid. So I got this information. I was communicating her. She told good result. But it's very difficult to explain from a modern perspective, but from Ayurvedic perspective, definitely. So because when you have a kapha dosha, a lot of kapha dosha in the rakta dhatu, Jalauka is a medicine of treatment of choice. So definitely it may reducing the kapha dosha so that the situation may be improving.
Okay, thank you, sir. And how to deal with the subclinical thyroid dysfunctions?
This is a very good question because a lot of people now nowadays have the subclinical hypothyroidism. The easiest thing is that ask the people to use regularly some appetizers. It may be a ginger water, it may be a trigodu tablet, it may be a shadanga toyam, like that. That's enough. That is more than something that really ignite the Agni and ask them to reduce the junk food. That is enough. Most of the subclinical hypothyroidism symptoms will come down.
Okay, thank you, sir. And what about the use of milk and milk products to avoiding the thyroid disorders? Is there any experience regarding because some sort of protein allergy is mentioning, right?
There are many reasons. One thing from Ayurvedic perspective, the gunas of the milk are actually opposite to the symptoms of the hypothyroidism. So the Swadubhagar snigdam ojasyam dhaduvardhanam vadapittaram snigdam shleshmalam gurushidalam. So vadapittaram snigdam guru shidalam, these all gunas actually already they are not in the hypothyroidism. So this will really Buddhi Samani Sarvesham. So all the will create a lot of vritti in the given situation. So I strongly advise people to cut down the milk and milk products, especially paneer, pizza. When people start taking this type of cheese, definitely these are really, really very, very bad when people have hypothyroidism. And Dr. Sushila Saji is there. I think she's going to speak about Patya Bhatya. And definitely she's a very experienced doctor in this field, and definitely she will be adding her own observation. I really looking forward to her opinions too in the coming presentation.
Okay, thank you, sir. And regarding the recurrence of these thyroid disorders, what's your experience? You see, so far recurrence is concerned, it is actually because of the metabolic imbalance, and it is poor metabolic corrections. The recurrence happens because if not treated properly and not addressing the real hetu or the nidana, most of the time conventional science is doing, it is only a biochemical balance. Okay, when there is a problem in the thyroid, they found, okay, TSH is high, it is 50. Okay, T3 is normal, T4 is normal. Okay, this is a primary hypothyroidism. They start levothyroxine. So it gives a message in the body is that, okay, thyroid gland is not producing T3 and T4, but you have an external source. Process by which you get things. So you be happy. With that. It's just like we are having a guest in our house. Not guest, somebody is in the house, and we are giving just keep on giving food to that person, so that this guy will not work at all. You keep on feeding this guy will not work. So if the person is there with us, we are expecting him to support us. We are expecting him to give some service from us, so that it will work. But what happens over a certain period of time, the same levothyroxine what the people takes will start cellular resistance. This is a very very crucial thing. Just like very established theories are there about insulin resistance. There are so many situations where cellular resistance are happening in the thyroid. So how to avoid cellular resistance? It is almost impossible from the modern science in the biochemistry level. They are working on it. But for us, it is very easy. See, because it is Ama and Shroto Dushti is there, so we give some Amahara. Shroto Dushti, it will work. So we can ask the person to take levothyroxine with Panchapola Kashaya.
Okay. And regarding the vitamin D deficiency, which is common now, so you already mentioned it. And is there any, what we can do in that case?
Actually, this is another thing. Nowadays, it's a very big trend that lot of people, when people comes with joint pain, when people comes with unidentified polyarthralgias, medical doctors will start looking at the other possibilities. Normally, olden time people will check ESR or ASO titer. Or they will say anti-nuclear antibody to check about the other chronic connective tissue disorders. Like SLE, other things. The trend is different now. Looking for the problem instead of the shakha, they will look at the problem in the koshta. So they will see there is some deficiency in the koshta, that is the vitamin D deficiency, and they start giving calcium and vitamin D3 like shell and other products. But very interestingly, these are useless things because this may give some temporary. But until otherwise we don't correct our Agni, these medicines are simply defecated through our mala. So even in the vitamin deficiencies, the simplest thing you should want to do, if you find a vitamin D less than 20, which is said to be the abnormal, so imagine 10. You just ask the patient to take Girda, 3 days Snehapana. Simple in the house. You just give 25, 40 or 60, 3 days. One day rest, give a virechana with a simple Avibhati Churna. Then ask them to do a test. Again, vitamin D. Definitely you can see it is increased. And when sure, I have done many cases. So funniest thing that what we have done, we have not done any treatment to the vitamin D. What we have done, we have made a cost